task. Our next task would be sickle cell disease. In this particular case, we're an FY2 in a GP surgery. A 32-year-old man has made an appointment to see or has come for a follow-up. This particular patient was screened for sickle cell disease and other blood disorders twice, which came back normal. So all the investigations for sickle cell disease and other blood disorders were done and they were all normal. What you must do is talk to the patient and address their concerns. Patient information. His brother has got sickle cell disease and is worried he could have the sickle cell disease as well. But he has been screened for sickle cell disease and other blood disorders, and all the tests came back as normal. He currently does not have any symptoms, but he has a history of anxiety, and that is being managed. So generally, he's an anxious person. Approach the task, grapes as usual. So how can I help you? Doctor, do you think I've got sickle cell disease? Then you have to explain, okay, is there any particular reason why you feel you may have sickle cell disease? Because my brother has it. Okay, so I need to ask you some questions just to get a better understanding before I can answer your concern. Then you're going to take a history of sickle cell disease. What symptoms? Recurrent, do you suffer from recurrent chest infections? Do you have any joint pains? What about anemia? Okay, do you get tired? Any shortness of breath? Any palpitations? Any lightheadedness? Okay, have you ever been diagnosed with anemia? We're going to be asking those questions. Then you're going to ask the family history. Is there anyone in your family who has ever been diagnosed with sickle cell disease? Is there anybody in your family who has ever been diagnosed with any blood disorders? If you say yes, my brother has. Okay. Do you share the same mother and father? Yes. What about your parents? Does any of your parents have sickle cell disease? No. This particular patient, none of the parents have got sickle cell disease, but his brother has got sickle cell disease. And nobody else has got a blood disorder condition in his family. He has got some concerns. Doctor, do you think I could have sickle cell disease? And we said, when they asked that question in the beginning, important to ask any particular reason they feel they could have sickle cell disease, and have they been told about the investigation they had? So you continue the rest of the history. The PMAFTOSA, the ARIS, the effects of symptoms. Remember the PMAFTOSA one more time. It's the past medical history, medication history, allergies, family history, travel history, occupation, social history, anything else. Now, we have taken the history, we do an explanation. Explain that he has been investigated for sickle cell disease and he does not have a condition. And all the tests have come back normal, including the test for other blood disorders. So he does not have a sickle cell disease, and he will not develop a sickle cell disease because he has been tested. And therefore, if he had it, that was going to come up. And also, he's not a carrier because they didn't find him from any sort of carrier situation. Okay, good. So he cannot develop. So just going to change this, cannot develop a sickle cell disease in the future. Cannot. That's one sentence, just to make it clear. That's one sentence. Cannot develop sickle cell disease in the future because he does not have, and he was not found to be a carrier. That means carrying a gene that causes a sickle cell disease. Now, explain the mode of inheritance of sickle cell disease. Sickle cell disease is inherited in an autosomal recessive pattern. Okay, now this may be difficult for you to understand, but what it simply means that if your brother has a sickle cell disease, this means both of your parents are likely to be what? Carriers of the disease. And each one of them must have passed one gene for sickle cell disease, or one affected gene to your brother. And this is why he has a sickle cell disease. So you need to inherit two affected genes from both parents, one from each parent. Okay, so, but your parents were just carriers. As we mentioned, they didn't have a disease, which means they were just carriers. They were carrying a gene that causes sickle cell disease. If both parents are carriers, there is 1 in 4 chance, or that is 25% chance that the children will have sickle cell disease. Okay, good. Now, there is a 1 in 4 chance that they could not pass the affected gene to their children. What simply means that yourself, you don't have a sickle cell disease, okay, and you're not a carrier. So you're one of the what? 25%, one of the 1 in 4 who did not receive this, who was not affected, didn't receive the gene for sickle cell, okay, and they did not get sickle cell. But there is the 50% chance, that means half of the siblings or the children will carry the gene of sickle cell, but they will not have the disease. Now, sickle cell disease, people who develop sickle cell disease generally, people with sickle cell disease have inherited the gene for sickle cell from one parent and a gene for abnormal hemoglobin from another parent. So this is likely what have happened with your brother. One gene for sickle cell from one of the parents and another affected or abnormal hemoglobin from another parent. Okay, so you need to inherit one gene from both parents, from each parent, okay, to have a disease. Okay, now if you people who are what we call carrier, or sometimes they are called sickle cell trait or carriers, okay, inherit a gene for sickle cell from one parent and a gene for normal hemoglobin from another parent. So for one gene of sickle cell from one parent, but normal hemoglobin from another parent. Because they have got normal hemoglobin from another parent, which is not affected, they can only be a carrier. In other words, they are called sickle cell trait. Okay, good. These people, they have no symptoms, but they have a 50% chance of passing the gene to their children as well. Okay, so in this case, what has developed is most likely that both of your parents were carriers and they did pass the gene to their children. Okay, to your brother received both the genes and therefore he has a disease. You didn't receive any of the genes. You're not a carrier. You do not have a disease either. So this is a tree in here to explain that this is a gene for cystic, a gene for sickle cell disease. Gene for sickle cell disease, okay, and your father also had a gene that causes sickle cell disease. These are the genes of your mom, these are your father, okay. So each one of them was a carrier. So this is a gene of carrier for sickle cell. This is a gene of carrier of sickle cell. So if you pass to your child in here, and here you pass to one, this one will have two genes, one of sickle cell, one of affected hemoglobin, or maybe both of sickle cell. Then you end up being affected. If you carry only one gene from one parent, like in this case, they only be carriers. To have a disease, you need to inherit two genes, one from each parent. So this one is a carrier, this one is a carrier as well. This one is normal, did not receive any of the genes from either of the parents, which is, I believe, it is in your situation, you are here, the 25% who did not receive any of the genes. Those that receive one, they are carriers. Those that receive both, two genes affected, they are what? They have a disease. Okay, so reassure that he has been tested and he has got no disease and is unlikely and he is not a carrier. So, and it is unlikely and it cannot develop in the future. Thank you.